see right there, and I only have 2 reporters. No one has their hand raised yet. So we'll see. Hannah Gravenstein always comes in like 2 minutes after, so maybe we'll see. It's like, oh, Hannah's here.
Oh, yeah, it's new.
Right. Let me think about that, yeah.
66.
Good afternoon. Welcome to the COVID Joint Task Force briefing. I'm going to start with some slides today. Total COVID-19 cases reported today, 151,851 over the course of the pandemic. New cases reported today, 265. That is up from 216 cases reported this time last week and the 176 cases we reported 2 weeks ago. The 7-day average of cases per day is now 178. That is up from the 171 average this time last week, an average of 104 2 weeks ago. Next slide. 7-day average test positivity rate is now 5.1%, which is up from 4.4% this time last week, but down from 5.9% reported 2 weeks ago. Next slide. The effective reproductive number, or RT, of the virus is now 1.14, a slight increase from 1.12 reported last week. An RT greater than 1 indicates that each case is infecting more than one other person, meaning that the epidemic may be growing rather than shrinking in the community. Total COVID-19 hospitalizations as of December 1st, 121, with 32 in the ICUs and 89 in acute care. That is a slight increase from what was reported 2 weeks ago. Next slide. Currently, there are 1,927 active cases in Shelby County, and that is an increase from 1,624 active cases last week. There have been 2,413 fatalities over the course of the pandemic. This slide shows active cases in the metropolitan counties in Tennessee. As you see, Shelby County, shown in blue, has among the lowest case rates over time in that range, and that may be attributable to some of the mitigation efforts that we've put in place. Next slide. This slide shows active cases by age. We have seen in active cases across most age groups increase, but it has decreased in some of the older age groups, except for the 65 to 74-year-old age group and the 75 to 84 age group and the 85 plus, where it's decreasing. Next slide. This is a map showing the active cases by zip code. As you have noted in the past, the darker areas indicate that there are more active cases in the population in those zip codes. Next slide. And this is a map showing the active pediatric cases by zip code in the county. Once again, the darker areas show areas where there are more active cases in the county from a pediatric standpoint. Next slide. This chart shows the average case rates for kids 5 to 18 years of age across the state in some of the larger metropolitan counties. As you can see, Shelby County is in kind of a turquoise blue, halfway between some of the counties like Sullivan County that have a higher peak and Hamilton County that is down around where we are. And you can attribute some of these numbers to the mask mandates that we've had in place in our K through 12 schools. Next slide. This chart shows the first, second, and third doses by date, with the third doses in darker blue. More than 1,092,000 Shelby County residents have received at least one dose of vaccine. Next slide. Currently, 56.8% of the eligible population has received at least one dose of vaccine. 48% of the population is fully vaccinated, having completed a series of 2 vaccinations or more. The goal is to have at least 70% of the population fully vaccinated. To break down those numbers a little further, in the 5 to 11-year-old category, about 6.9% of our 5 to 11-year-olds in the county are now fully vaccinated. And if you look at a proportion of the eligible fully vaccinated population, that's at 52.3%. Unfortunately, we still have not broken that 50% mark when we're looking at fully vaccinated as a percent of the total population. That's the end of my slides. The Germantown Baptist vaccination site will be open from 9 a.m. to 4 p.m. tomorrow, providing first, second, and third doses to anyone 12 or over. That site will close after operations tomorrow. The Health Department's immunization clinic at 814 Jefferson is open each Monday through Friday, 8 a.m. to 4:30 p.m., and offers vaccinations for ages 5 and older. No appointment is needed. This Saturday, the Shelby County Health Department will provide Pfizer vaccines to anyone age 5 and older at Collage Dance Collective at 505 Tillman Street in Binghamton. Also remember, now children ages 16 and 17 are eligible to receive Pfizer booster shots if it has been at least 6 months since they had their second dose of COVID vaccine. These boosters are available each day at the Health Department's immunization clinic, as well as other providers across the county, and will be available tomorrow at Germantown Baptist site and will be available Saturday at the Collage Dance Studio. And with that, I'll take your questions.
Abigail Warren, Daily Memphian.
Good afternoon. I wanted to see if it's flu season in addition to COVID going around. Is there any way to, for the community to tell whether they have flu or whether they have COVID? And if there's a difference in those symptoms? Obviously it's easier to get tested for COVID than it is flu.
Well, that's a great question. I don't know if I agree that it's easier to get tested for COVID than flu. Our providers across the county have been testing for flu for many years and also giving flu vaccine for many years. The symptoms are the same in a lot of cases, and so if you are experiencing cough, runny nose, headache, fever, it's always good practice to not only get tested for COVID, but also to get tested for the flu.
Okay, and the recent uptick, do you believe that's still attributed to Thanksgiving, and do you expect that trend to continue through the remainder of the year and the holidays?
Well, as you can imagine, a lot of it can be attributed to Thanksgiving, but what I would say is much of it can also be attributed to the fact that this is the holiday season. More people are gathering, and I don't like to admit this, but I believe more people are being a little bit more lax about how they protect themselves. And so if I can give one message today, I'd say remind people, please, please wear your mask when you don't know the vaccination status or the illness status of the people around you, particularly if you're in indoor public spaces. And then the other thing is to remind folks, if you have not gotten your booster dose yet, now is the time to do it if you are at least 6 months out if you had Moderna or Pfizer, and at least 2 months out if you had the J&J. It is even more imperative to get that booster dose in now as we await results from around the world on how the Omicron variant will not only affect Shelby County, but will affect the U.S. overall.
That was our only question today, so I'll send it back for closing messages.
The biggest closing message that I can give today is, 1, know your status before you gather. So what does that mean? That means that you need to know the vaccination status of the folks that you will be gathering with for the holidays, but you also need to prepare to have a COVID test before gathering. Remember that even if you are vaccinated, fully vaccinated and boosted, if you get a breakthrough case and you're not having symptoms, you can still spread COVID to others. So it's even more important to know your status before you gather with others before the holidays. 2, get boosted if you have not already done so. We know from early studies that the booster doses are providing some level of protection against the Omicron variant. Many of you know that we already have 2 confirmed cases in the county, and I suspect that we will have more in the days and weeks to come. So the best way to protect yourself is to get a booster dose of vaccine if you have not already done so. And for those of you all who are eligible and have not been vaccinated, that's where number 3 comes in. Get vaccinated. It's so important to get vaccinated. If you've been sitting on the fence for yourself, for your children, for your family members, for your community members, now is the time to get vaccinated, or if you are already vaccinated and boosted, to convince those folks in your life that you know have not been vaccinated to do that. And finally, 4, I talked about this earlier, continue to do all of the things that you've been hearing about for almost the last 2 years. Stay masked up if you do not know the vaccination status or the illness status of the people that you are around. It couldn't be more important than it is right now to continue to do the things that we know work: masking, vaccination, and social distancing. So with that, I wish you a happy holiday season. Please continue to protect yourself, and we will see you back.
Thanks, everyone. Have a safe weekend.